Diabetes mellitus, Part 1. Diabetes mellitus, the disease process and its effects. Diabetes mellitus is a fairly common endocrine disorder affecting dogs and cats. Just like in humans, this disease is devastating to the body when left undiagnosed and untreated. It is important to be able to recognize the history of symptoms that describe a diabetic suspect, understand the laboratory results that confirm a diagnosis, and become familiar with the modalities of treatment for diabetes in order to educate your clients in all aspects of effectively managing this incurable disease. We should start with a basic understanding of the disease process that occurs in diabetes. All cells require energy in order to function and survive. When food is consumed, the body takes the food and breaks down fat, protein, and carbohydrates for energy. During digestion, food is broken down into a basic unit of fuel known as glucose. The glucose is then absorbed into the bloodstream, where it is carried to all cells throughout the body to be used as energy. However, cells cannot utilize the glucose without a mediator known as insulin. Insulin is a circulating hormone produced in the pancreas. After a meal, the body's blood glucose levels rise, and the pancreas responds by releasing more insulin into the blood. The amount of insulin produced is directly related to the amount of glucose in the blood. The hormone then transports the glucose into the cells where it is spent as fuel. Cells cannot utilize glucose without insulin, and the insulin must be recognized by the cells in order to deliver glucose. Diabetes is an interruption in this critical process. Diabetics may have either or both a deficiency in the production of insulin, type 1 diabetes, or a resistance to the mechanism of insulin, type 2 diabetes. In either case, glucose is not delivered effectively to the cells, and instead remains in high concentrations in the bloodstream. The cause of diabetes in a specific patient is not always known. However, there are certain risk factors that can contribute to the development of this disease. Type 1 diabetes, the most common form in dogs, is caused by insufficient production of insulin. Insulin is made by specialized cells in the pancreas called beta cells. In type 1 diabetes, the pancreas produces little or no insulin. Without insulin, glucose cannot be utilized by cells as a form of energy. As a result, the glucose remains in the bloodstream, causing high blood glucose levels. Over time, it is the high blood glucose levels that can lead to the damaging health complications of diabetes. Insufficient production of insulin in the pancreas could be a result from chronic pancreatitis. Pancreatitis can be triggered by certain drugs, infection, shock or trauma, diets high in fat, and obesity. Some breeds like Schnauzers are predisposed to chronic pancreatitis, which makes them more likely to develop diabetes. In type 2 diabetes, the body cells are less responsive to insulin, making it difficult for cells to accept glucose as fuel. Patients with type 2 diabetes may have normal or even elevated levels of insulin, but the cells in the body reject it during the transfer of glucose. This is called insulin resistance. As a result, there is a reduction in the delivery of glucose to the cells and elevated blood levels of unutilized glucose. Cats are more likely to have type 2 diabetes related to inappropriate diets and obesity. Obesity is a common trigger of this type of diabetes. The relationship of obesity to insulin resistance is known, but the mechanism is not completely understood. It is important to realize the link between obesity and diabetes, since this is a contributing factor that can be controlled. Obese pets are more likely to develop pancreatitis, leading to type 1 diabetes, and they are more likely to develop insulin resistance or type 2 diabetes. Appropriate diets and healthy feeding regimens can significantly reduce the pet's chance of becoming diabetic. To complicate things further, an adrenal gland disorder known as Cushing's disease can make controlling diabetes very difficult. Cushing's can be a contributing cause of insulin resistance and thus diabetes. Somewhat common in dogs, Cushing's is rare in cats. However, more than 80% of Cushingoid cats develop concurrent type 2 diabetes. The toll that diabetes mellitus takes on the body is widespread and cumulative. Its effects are caused by both the reduction in the delivery of glucose to the cells and the elevated blood levels of unutilized glucose. The symptoms of diabetes may be subtle early in the progression of the disease. Diabetes tends to afflict adult dogs and cats, and since they cannot communicate how they're feeling, lethargy is often mistaken for maturity.